Hello, and thank you for joining me. My name is Helen, and I'm the presenter for the Nutrition for Mental Health program for health professionals. I really appreciate you being here and actually taking the time to come and listen to me. I'm really passionate about this topic, and throughout this little presentation, you'll understand a little bit about why I'm so passionate about this topic. So I appreciate you for being here, and I hope that you will sort of join me in this little journey about nutrition and mood and what we can do as health professionals to actually support the people that we're working with when it comes to nutrition and mental health. So a little bit about me. I am a nurse and I've been working in psychiatry for over 20 years. And I think what happened for me is about 8 or so years ago, I was at work one day and we were at our morning meeting and we were discussing the patients that had come in overnight. And all of a sudden, it just kind of struck me that I didn't feel that we were doing a very good job when it came to actually getting people well. So, so many people are struggling with mental illness and poor mental health, and they come into the medical system and we do our best. Obviously, at that stage, I was working in liaison psychiatry, so we would, do some brief therapy if we could, but often we would sort of just, help the person as much as we could and send them out into the community, hoping that they would get the care out there. And the care is very much around talk therapy and medication, which I'll talk about a little bit further, but I really felt that there was something missing. There's really something missing when it came to psychiatry, and that has sort of prompted me onto this journey of investigation to figure out, well, what else is out there and what else can we be doing as health professionals? Just a little bit on some of the statistics. This is some of the New Zealand statistics from the Ministry of Health, looking at 2020, 2021 data. That psychological distress among adults has increased over time, with nearly 1 in 10 adults, so 9.6%, having experienced psychological distress in the 4 weeks prior to this 2020-21 survey. And this was an increase from 7.5 in 2019 to 2020. I don't know what the more recent data is, but I can only imagine that perhaps it's higher with COVID and all the subsequent fallout from that. And adults living in the most deprived areas had higher rates of psychological distress, and this seems to be quite common, I think, in areas all over the world. Briefly looking at some USA statistics, 1 in 5 US adults experience mental illness each year, 1 in 20 US adults experience serious mental illness each year, 1 in 6 US youth aged between 16 and 17 experience a mental disorder each year. 50% of all lifetime mental illness begins by the age of 14 and 75% by the age of 24. And suicide is the second leading cause of death among people aged 10 to 34. So there are some very grim statistics out there. In the UK, 75% of mental illness, excluding dementia, starts before the age of 18. Men aged 40 to 49 have the highest suicide rates in the UK. 70 to 75% of people with diagnosable mental illness receive no treatment at all. It is estimated that 1 in 6 people in the past week experienced a common mental health problem. And this, unfortunately, is quite old statistics that I could find, but in 2014, 19.7% of people in the UK aged 16 and over showed symptoms of anxiety or depression, and that was an increase from the year before. I'm not sure if there's any years that we have had decreases in the statistics regarding mental illness, but these are some of the stats that we are dealing with and we're working with. And I know that it feels a little bit like it's a never-ending problem. Like, when is this all going to end? We can't carry on having these statistics rising and rising and rising, and we know that staffing shortages are a real concern. So it kind of certainly leaves me feeling a little bit powerless, actually, as to, well, what is the solution here and what can we do? And I know that there are a lot of amazing things happening in the mental health field. I know in New Zealand specifically, there's a lot more talk and there's a lot more discussion around how we can support each other with mental health. And there's a real push to increase availability of counsellors and psychologists. So I know that there's greater conversation and greater awareness. But I think we're still missing the point a little bit in that we're still being the ambulance at the bottom of the cliff, and we're not really targeting prevention. We're not really trying to prevent people from becoming unwell in the first place, and really using that as our focus when it comes to mental health and well-being. And that is one of the things that this course that I've developed is actually about. And it is only one component, but I think it's a really important component. So if we ask about why nutrition and why I've become passionate about nutrition as part of one of the treatments, I guess, for mental health, and we can ask the questions that, well, what does food and diet have to do with mood? And what should we as health professionals, so why should we as health professionals be addressing this? So we have these two modalities of treatment. As I mentioned before, we have medication and we have talk therapy. And each of these modalities can work really well for some people. Medication by itself can work really well for some people. Talk therapy can also work really well for some people by itself. And when we combine the two, we know that we get an enhanced efficacy of these treatments. So we know that for some people, this is actually enough for them. But we also know that only 60 to 70% of patients with depression actually respond to antidepressant therapy. So this is from some of the research. And when we talk about anxiety disorders, only about 60% of patients respond to the frontline interventions, such as serotonin reuptake inhibitors, so SSRIs, and cognitive behavioural therapy to any significant degree. So we do have a real problem with treatment resistance when it comes to treatment of depression and anxiety. And I have to say that throughout the course and throughout this introduction, I am mostly talking about depression and anxiety because this is where most of the research has been done. It's quite hard to find research around schizophrenia or bipolar or other serious mental illness. So most of this research has been done on depression and anxiety, but I do get some other snippets of other types of mental illness in there as well. So what else are we missing? And what else could we be looking at when it comes to supporting somebody with a mental illness and helping them become well? Now, we know that there are loads of things that impact mental well-being. We know that there's psychological factors. We know that people, for example, with adverse childhood experiences have increasing rates of mental illness. We know that repeated episodes of stress cause us to be more likely to suffer from a mental illness. And we know that there are physical and lifestyle things that contribute to poorer mental health. And we certainly know that there are social and economic determinants that contribute to mental health as well. And I just really want to point out here that nutrition is one small part of a large sort of range of factors that contribute to poorer mental health. But I do think it's a really important factor. And I think it's an important factor because I think that we as health professionals often don't address it. We don't feel comfortable talking about it. We're very aware of some of these other aspects of contributors to mental illness, but we don't often talk about nutrition and food. And for me, as a mental health nurse who'd been working in psychiatry for a very long time, when I started to look at the research around this, I was quite shocked at how little I knew. And I sort of thought, well, why aren't we aware of this? Why is it not being taught? Why is this not being included as part of our training? So I'm talking about nutrition, but it is just a part of an overall lifestyle medicine picture. So lifestyle medicine provides an interdisciplinary whole system approach to prevention and reversal of chronic and lifestyle-related diseases through the modification of the behavioural, social and environmental drivers. So nutrition is one part, and there, as I've said, there's loads of other things that we can look at. But as I mentioned before, the research on nutrition is quite clear. There's a lot of it out there, And my aim is to bring this research to you into this course so that you feel confident with the information that you have, and that you feel confident in actually speaking to your patients, the people that you work with, about how food can impact mood and what they might be able to do. And I think that's so important, that the person receiving the information actually starts to feel empowered as well, that they can do something. I mean, there's lots of little things they can do, but this is one of the other things that they can do to actually support their mental health. So I want to talk a little bit here. This is this is an example of a real light bulb moment to me. And I was at a conference in Melbourne in 2017, and I kind of started my journey of investigation, and I joined ACNEM, which is the Australasian College of Nutritional and Environmental Medicine. And I was at one of their conferences, and this is when I first heard Felice Jacka talk about the SMILE study. So if you don't know about the SMILE study, it was Australian-based study, and it was a 12-week parallel group, single-blind, randomised controlled trial. And what they did is they had 67 people who'd been diagnosed as being moderately or severely depressed using the Madras scale. And they were divided into two groups, and one group had dietary intervention, which involved a dietitian discussing changing their diet from a SAD diet, a standard Australian diet, into a modified Mediterranean diet. And the control group received social support for the same length of time that the intervention group were getting the nutritional sort of counselling. And what they found after 3 months is that those who received the dietary intervention training, over 30% of them were found to be no longer depressed, so no longer suffering from a depressive illness. So I remember hearing this at this conference, and I don't even know if the work had been published at this stage, and I just went, my goodness, why? This is amazing information. This is incredible. And if this works for depression, what impact does food have on other types of mental illness? So it really started to pique my curiosity about food and mood and the impact that changing a diet might have on somebody's mental health and well-being. So this is when I sort of started my real journey, and I really started to dive in. Well, what is it about nutrition? What is it about food? And what other data is there out there? What are the other studies saying about food and mood? Just looking at going back to the SMILE study, the numbers needed to treat were 4. So 4 people needed to change their diet in order for them to no longer be suffering from depression. And if we compare the numbers needed to treat to antidepressants, for example, for a tricyclic antidepressant, the numbers needed to treat ranged from 7 to 16 with a median of 9. And for SSRIs, the numbers needed to treat were 7 to 8 with a median of 7. So the Mediterranean diet change actually had higher efficacy than some of our antidepressants that we use. So this is, to me, this is really important and incredible information. And like I said, it's not well known in the area of psychiatry. So to take you through a little bit of the content of the course that I run currently, in part 1, we really dive into the association between diet and mental health and mental illness. And we look at, well, if I change my diet, will my symptoms improve? So we look a lot around the research that's out there, the impact of diet on mental health. If I improve my diet, will my mental health improve? And Felice Jacka answered that question with her study, but we sort of look into a few other studies around this question. And then I really sort of dive into, well, what are the potential components? And is it what people are eating or what people aren't eating? Like, what is it about changing a diet that actually improves their mental health? I take a good look at some of the things that the different types of fats that we consume and the impact that that has on our mental health and well-being. I look at the impact of gluten, and that's a little bit of a difficult issue to discuss, but gluten is one of these things that some people have a real immune response to, and that actually impacts their mental health, and the same with dairy. So I look at the research behind that, the studies that have been done, and obviously the junk food diet and the impact this has. I also look at, well, what are people eating and what are we actually feeding people when they come into hospital? Because I think that that's very important. Hospital is supposed to be a place where people get well, and the idea is that they come in, and hopefully part of their treatment or getting well is to actually get good quality food. So I have a look at that as well. And obviously we dive into some of the Ministry of Health guidelines. These are the Ministry of Health from New Zealand guidelines. And we also have a look at the modified Mediterranean diet. What is it and what does it actually look like? In part 2, we really start to look at the vitamin and mineral deficiencies in the mentally ill. So we look at the common vitamin deficiencies that people with mental illness are experiencing, and sort of have this discussion about, well, is it vitamin deficiencies? Is it that they're not eating certain foods, they're getting vitamin deficient, and that's actually impacting on their mental health and well-being? And if that's the case, if we change their food, that might help, but maybe we need to do more. Maybe we need to look at supplements. Maybe we need really large doses of multi-vitamins to actually support a person to sort of regain their health and well-being. So we look at the nutrient deficiencies in people with mental health issues. We ask the question, does taking supplements help? I also discuss some research, such as this one, which is published in 2002 on the influence of supplementary vitamins, minerals, and essential fatty acids on the antisocial behaviour of young adult prisoners. And this was a randomised placebo-controlled trial. Fascinating study with really interesting outcome. We also discuss normal blood levels, like what is a normal blood level, and just because a blood result is within reference range, is that okay? Is that enough for a person to be well? So I have a look at a bit of the research around reference ranges as well, and what we should perhaps be looking at as an ideal reference range, rather than just, well, it's within 98% of the population. We have a look about why vitamins and minerals matter. What is it about vitamin and minerals, and how do they actually help the body and the brain function, especially obviously when it comes to mental health and well-being? And then what can we do as health professionals? What can we actually be advising people? And I think for me as a nurse, I really felt out of my comfort zone before knowing all this about what I could talk to people about. And so I felt very nervous about talking to people about a diet. I didn't want to step on, the toes of a dietitian, for example. Was I stepping outside of my boundary? But the more evidence I've gathered on this and the more research I understand, I know that we can discuss the current research, and we can actually rely on this research to actually support our advice that we're giving to the clients that we're working with. I also look at, well, how do we assess diet? How do we ask the clients about diet? What do we need to actually ask from them to get a really good picture about what they're eating? And once again, what can we advise? So part of this course also is really about stimulating the conversation, not only between you and your patients, but stimulating the conversation in general circles of psychiatry and mental health, or within your GP clinic, about what else can we be looking at when it comes to treating somebody with a mental illness? Can we actually be doing more for them in the way of giving them more guidelines about lifestyle medicine as a whole, but also dietary guidelines about encouraging them to eat better, and how might we go about doing that? And obviously, I would love for you to really start thinking outside of the square. So this is just promoting and encouraging a different way of thinking and dealing with mental health and well-being outside of the two main paradigms of medication and talk therapy. So I would really love for you to be part of this course. It's really been a labour of love for me, and it's been, I guess, over 5 years of research and content that I've pulled together. The easiest way to join is probably to go to my website, which is www.onelifenz.com. Have a look at nutrition courses. That takes you to a main page. You can click on there and be taken to a landing page where you can start the enrolment process. If you're already here on the course page, thank you. It's an absolute pleasure to have you on board. Please feel free to ask me any questions. There is space for discussion throughout this course as well. So once you have joined and signed up, there are places for discussion, and I will be updating it and checking in very regularly so that I can support you in this journey as well, and we can continue this conversation. Thank you for being here. Take very good care, and I look forward to seeing you soon. See you later.